We're talking to Dr. Paul Henny in Roanoke, Virginia, and he's calling himself a biologically aware dentist. And that's very curious. What is that all about, Paul?
Well, it's kind of represents a mental shift, really even a mental shift from the way I was trained and the way I thought for a number of years, which was most dentists are trained to basically find problems and fix them in some mechanical way, or if it's an infection, maybe hit it with an antibiotic or something like that, versus a mindset where you're oriented towards asking the question, why did this happen in the first place? What's driving it? Uh-huh. And that question, more often than not, leads to some bacteriological answer. The diseases that are common in dentistry, dental decay, gum disease or gingivitis, or periodontal disease, infections of the bone around the teeth, are all driven by bacteria. And it's the presence of these bacteria in unusually high levels, these pathogens, unusually high levels, is what creates the problems that we recognize and diagnose and try to treat. So if we're not addressing the cause, the presence of these bacteria, then we really are never eliminating the problem. We may be tamping it down, we may be doing other things to manage it, but we're really not addressing the core of the problem. So being a biologically oriented dentist, we take into consideration the whole picture, not just the damage that's occurred or the active disease that's present right now, but the actually causative agents.
When I've gone to a dentist in my lifetime, I didn't have what I thought in my mind were any of these diseases. I was just having a lot of cavities and a lot of decomposition of the tooth. Is that all caused by this biological activity?
Absolutely. Dental decay is an infection. What we recognize as dental decay, whether it's a brown spot on our teeth or a tooth breaking because it's weak, because it's been undermined by decay, that is the outcome of a long disease process, the presence of certain bacteria, Streptococcus mutans being the main one in the case of dental decay, that when it's present in a high percentage of the plaque that's present in our mouth, it releases acids that dissolve the enamel and other structures of the teeth that lead to what we can visually see as decay. But the causative agent is not the fact that you're not brushing your teeth enough, not the fact that you're not going to the dentist enough. The causative agent is that these bacteria are present. And so if we don't deal with the problem on a bacteriological level, we never are resolving the problem. It's sort of the rough equivalent of you having a house that's on fire, and instead of focusing your attention on putting out the fire first, you hire a carpenter and you have them repair the house, even though the house is still smoldering in the background. You're not dealing with that. You're just dealing with the repairs. So a lot of dentistry has ended up functioning in that way because that's the way dental insurance is structured. Dental insurance is structured to deal with the mechanical means of dealing with these biological problems.
So when I think of a dentist, I think of whirring drill bits and shots in the mouth and mechanical picks that pick around. You must have different kinds of tools then if you're going to deal with the biological level, because those won't detect biological pathogens.
That's right. So those are all mechanical means of dealing with the outcome of disease states, okay?
So now I understand what you're talking about. All right, so help me understand some of these tools.
All right, so what's changed more recently is now we have testing instruments. In the same way that your physician can draw your blood and look at the percentages of a number of things that are present in your blood, too high and too low and so forth, we can do the same thing now in the mouth. We can actually take a sample of your saliva, we can look at the bacteria that are present, and there are hundreds of them, and we can identify the bacteria that are present that are pathogens, and then we can look at the percentages of those, how predominant are they, and we can therefore identify the reason that you're having the problem, or even project that you're likely to have a problem because certain bacteria are starting to predominate. So we can look beyond the mechanical, we can look beyond the macro and look at the micro, the microscopic level. In fact, what we do now is that we can also take a sample of the plaque in your mouth. We can just scrape a little bit of the plaque off your teeth, and we can put it under a phase contrast microscope, and we can look at that and get a general idea of which bacteria are there and what the level of pathogens present is in each case.
Can you do that in your office during a routine exam?
You can do that during a routine examination, yeah. And I would argue it's an important part of a routine exam, because you're not looking at the macro, you're also looking at the micro.
Interesting. So you need specialized tools to be more biologically oriented as opposed to all the mechanical tools.
Right. You need testing instruments like we were just discussing, and you need treatment instruments that actually treat
the biological
aspect,
right.
The causative agents. So one that we use is called a prebiotic that actually influences the bacteria that are present. It manages down the pathogens and it manages up the good bacteria. So they're, in addition to being more aware of our diet and things like that, and certainly oral hygiene is a big part of this as well. But we need to think about the problem on the bacteriological level first, because we'll never solve the problem. The house will never stop burning, to use that metaphor again, unless we do that first. So one of the problems in dentistry is that we historically, as dentists, we have a tendency to rush in and do repairs before we have even identified the cause of the problem, because the way money is distributed through insurance.
And people, and I have said, well, will insurance cover this? And then I find a dentist that insurance covers, and if that is my mindset, then some of these tools are simply not going to be available to me, because that dentist is strictly a mechanically oriented dentist.
Right. So if the dentist doesn't have has a practice philosophy that includes the microbiological elements of these disease states, then really they're just being reactive. They're just being repair oriented. So they're not really looking at your body as an entire system. And so the most effective way of managing these situations is to consider the mouth is a system, a very complex system that includes bacteria at the smallest level, as well as a lot of mechanical things, the way our teeth come together and our jaws move and all that. But that system is incorporated into a much bigger system, the entire body.
Yeah.
So one system influences the other. And so we need to look at the causative agents. If we don't really identify the causative agents, we're really kind of chasing our tail.
Well, things are moving at such a rapid pace. Now, you've been doing dentistry for many, many years. Is this a relatively new development, some of these techniques?
Yeah, the testing instruments are relatively new, and they're getting better and better. Some of the testing instruments have been PCR type tests became.
What's that mean, PCR?
They are the tests that were used for COVID that everybody became familiar with.
Okay.
They're not very accurate, but now we have genomic tests that actually can, measure the DNA present of certain bacteria and get very specific about what's there and percentages. So the testing instruments are getting much more sophisticated. And as a result of that, we can be much more accurate in our diagnosis. And if we've got a better diagnosis, then we can create more effective treatment strategies that are much more predictable.
You're probably one of the few dentists in the area that are practicing this way.
I am. This is an area that most dentists aren't focused on because they're so centered around how insurance companies disperse money to them. So they're not going to focus their attention on things that they're not immediately compensated for by insurance companies. So in a way, that paying attention to the wrong things doesn't eliminate the problems. It just allows the problems to persist, so the repairs are done over and over and over again, and the causative agents are never really addressed. And that can be frustrating for everybody. That can be frustrating for the dentists and the patients alike, to be constantly getting together and identifying problems and repairing problems, and boom, yet again, a year later, here we are, we're dealing with more of it.
Well, if you're watching this and you are a discriminating patient, is the word I would use, and you're looking for a dentist that can help you keep from having so much dental disease. Maybe you don't want to be 80 years old and have all your teeth pulled, and maybe you'd like to prevent some of that trauma. I would suggest contacting Dr. Paul Henny in Roanoke, Virginia. Information below on how to reach him. Fascinating guy. Thank you so much.
Thank you, Stan.